Welcome to an episode of Acu Show and Tell. I am Tara Akuna, registered acupuncturist, and joining me today is Catherine Parisien.
That's
Catherine,
right.
say it
You got
properly.
it.
How do you say your last name?
In French, it's Parisien, but I'm very much used to Parisian, so both are very fine.
She's a registered acupuncturist practicing out of Ottawa, Ontario. And thank you so much for joining me today.
My pleasure.
Yeah. So today we're going to talk about a client case that you brought to me. It's a woman who had a sudden hearing loss. Could you describe the case and then we could share the points that we would do?
Yeah, absolutely. She's in her 50s, and she came to me for sudden hearing loss in the right ear. So we did an intake and we talked a little bit. And what became very evident is this suddenly happened when she was going through a very hard separation. Um, Precursor to that, she also had a few vertigo spells that she knew was right before the hearing loss happened. Right now, she only has about 20% of muffled hearing in that right ear, but she can always hear a very high pitched tinnitus in both ears. Um, all scans, obviously, she seeked medical attention, and all scans came back clear, so nobody knows what she really has. Therefore, she came to see help with an acupuncturist. And I looked at the tongue also. The tongue is quite purple, so I am treating some blood stasis. I'm treating the liver meridian.
I have another question. So what's her energy like?
When she came to see me, she was also very, very, very fatigued.
Okay.
She had just went through what she said was a long COVID. So I did pump up her spleen a little bit. We did other points before we actually got to treat the ear, and that is now resolved. So now I'm full on treating the hearing loss.
Was there any improvement in her hearing when her energy improved?
No, the only thing that was different now, since we are doing the treatment, is she sometimes hears throughout the day sporadically a whoosh
Oh,
opening in the ear.
okay. And then just generally her emotional state, her stress levels. Is she
It's
still
a
going?
lot better
Yeah.
than before because that separation now is now finished. Um, but she did start back her full-time work because she was on work leave. And that has been hard a little bit on her to start back full time, but it is a lot better than when we first started.
Okay. And any regression in her hearing when as her stress levels go up?
No,
Okay.
no, the hearing is loss is
Mhm.
quite stable at 20%, but what is moving is the tinnitus. Sometimes it can go higher, but it's never a low tinnitus, it's always a high pitch.
And her demeanor when she sees you, like do you get an undertone of like irritability, stress, anger, controlling or
No, maybe a little bit of anxiety and stress, yes, but
um
no, quite happy and peaceful where she is right now.
okay. Well, I do balance method acupuncture, which is meridian diagnosis. So the points that I had chosen for her are based on rebalancing those meridians that are going into the ear, also to help reduce some stress, some of that stagnation. And she's a bit more anxious, so some kind of finger points are going to
Mhm.
be what I'm going to go into as well, because that's going to relieve um, like some anxiety and stress. So the points that I had chosen for the ear. I would do inner ear point. I'd probably do Shenmen. I might add kidney. And then I would do Yin Tong. On the left hand side, I would do lung 11, heart 9, pericardium 9. On the left side of her leg, I would do stomach 41 and stomach 43, gallbladder 41, gallbladder 43, and also bladder 63. On the right side of her arm, I would do large intestine 10, Sanjiao 9, and small intestine 7.5 for the inner ear. And then for on her leg on the left side, I would do liver 5, spleen 6, and kidney 7. And those would be the points that I would use. And I'm curious, and what points have you been using for her?
Right now, the treatment that my go-to treatment now is Li4 liver 3,
Okay.
spleen 10, GB4 distal I use GB43,
Yeah.
GB34,
Okay.
and GB20.
Mhm.
Sanjiao 5, Sanjiao 3, but now that is on the right side. Sanjiao 5, Sanjiao 3. And local, I would sporadically use Sanjiao 17,
Mhm.
SI 19,
Okay.
Sanjiao 21, and GB2.
And GP2. Okay,
I
great.
did one time because she had a little bit of neck um, neck pain and pressure. So I did do one treatment on Giagi cervical,
Okay.
and I still use these distal points. So,
Okay.
but
Excellent.
that's the my go-to treatment mostly.
Yeah, it sounds great. I'm curious, when you learned the ear points in school, did they teach you like an acronym GST? Like that's a Canadian tax. So it was like gallbladder, small intestine, and then triple burner. No, that's
No,
how
but
we're learning.
nice to learn. No, I didn't know that, but thank you.
That's the only way I remember the points around the ear. I was wondering
No,
the same way.
I still confuse the SI and the Sanjiao. Yes, I still
Yeah,
confuse the location of them, but
yeah.
they're good for the ears, both of
Yeah,
them.
those are great for many ear things. Well, that's great. Okay, so we have two acupuncturists, one case in two different ways we go about treating it. Bring this into your practice, try it with your clients and see how it works. I appreciate you, Catherine, for coming
Thank
on. It
you.
was so nice to see you, and I hope to see you again soon.
Thank you so much.
Have a great day.
Same to you. Thank you.